Good morning, ladies.
Good morning.
So we're here to talk about the urgent issues and opportunities associated with women's health. So good health being the foundation for agency, power, and influence. Let's paint a quick picture of some of the challenges. So women face systemic barriers to reproductive health care, dismissal of their symptoms and pain, research gaps, and health systems that fundamentally were not designed with women in mind. So the challenges are very real. Here's what's interesting about the opportunity. So the moral case and the business case of closing the women's health gap actually point in the same direction. So the World Economic Forum has identified a $1 trillion opportunity in closing the gap. So investing in women's health isn't a trade-off between doing good and doing well. When women are healthy, we all benefit. So let's dig in. Michelle, we're in a moment of immediate crisis. In fact, the news coming out of the States today indicates that may get worse. So rollbacks to access to reproductive health and to access in general. So what policy mechanisms are you finding work well to protect women's health, and what can we learn from that?
Yeah, thank you. It is a really difficult moment in the States, right? I think the way that we view healthcare around the world is different depending on where you are. But at least in the United States, we have not been able somehow to actually guarantee access to healthcare for people across our country. And especially with the rollbacks of Roe v. Wade, reproductive care and women's health care have been under attack across our country. And reproductive care is healthcare, and healthcare should be a right. And that's what a lot of states are pushing right now in the US. And it really is now dependent upon states to actually provide access for people in all corners of our areas. And so what we're seeing in especially blue states, I represent New York, there's a lot of legislation to both make sure that people within our state have access to care, but that also people around the country, if they're in touch with a New York doctor, they should also have access to care if their states are choosing to not protect their constituents and their residents. And so in New York, we actually have a shield law that was just put to the test in making sure that medical providers who provide medication abortion to people are protected. And that actually just went to the courts. We have a doctor who's a constituent of mine who was contacted by a young woman in another state, and her mother actually helped her seek out medication abortion. And sadly, her father is actually who turned them into the state. It was illegal in the state in which they were living. And there are 2 cases now against this doctor from 2 states, one criminally, one civilly. And the shield law has never been put to the test, now put to the test. And actually just about a couple weeks ago, I think 2 weeks ago, our shield law was upheld, which is a major win for people across our country. And so hopefully other states can see that. I think that about 20 states have shield laws in the US, and we now see that it actually can be upheld in court. Really quickly, we also have other legislation that many of us are working on to continue access to things like mifepristone if the FDA deems it dangerous, which they're starting to talk about. And by deeming that dangerous, you're then effectively banning abortions across the country without actually having to do that legislatively. So we have legislation to help continue the stockpiles that many organizations and our state has to continue to provide that access. And then prospectively, those are kind of 2 defensive things that we've done. Prospectively, also making sure that women and young women have access to the full spectrum of reproductive care, I think is really important. And when there's technology that exists to provide people the ability to have autonomy over themselves, right? Everyone should have access to that. And we're seeing things like egg freezing, right? Being able to, and preservation of fertilization, being able to actually have that for people. Really expensive in the United States, less expensive in other countries. You're starting to see that kind of tourism start. We should provide that to people in our country. We should have access to it. Just because you have money doesn't mean you are then the only person who's able to determine if you have, when you start a family, say how you start a family and what you want to do. So in New York, we were actually the Senate was the first chamber to pass a law that would require insurance to cover egg freezing and egg storage for people. And we're hopeful that more states will pass that as well.
Wonderful. So some hope coming out of New York.
We're trying.
Celia, so Belgium has universal health care and a system built on equity. Tell us about what women's health care looks like there, what's working, and what are some of the watch-outs?
I think we're not just worldwide, but even in Europe, we're one of the social islands that is still upright. And I'm very proud of that system and a big proponent of it. Also because I'm a senator, a delegate for Brussels, which is one of the most multicultural and cosmopolitan cities in the world, which is something that is not very known. But we have so many communities coming together, the richest, the poorest, people who are expats, but also asylum seekers. And the healthcare system is where we see them all. So this is not just a question of making your population healthier and making sure that the social elevator is in a good condition, because that's where people can start their ascension. It's also the place where you start your communities, but also your democratization. If you're talking about anti-radicalization tools, healthcare is one of the primary ones. You should invest, when you have radicalization, invest in social policies and healthcare, because that's the place that people will remember they're part of greater good. And it influences women on every level. So in healthcare, you see that worldwide, more than 7 out of 10 healthcare providers are women. But also women are the ones who are making the healthcare decisions. So they are part of every medal, of every part of the medal in healthcare. And you see that if you pay these healthcare providers well, if you provide them with good conditions, it elevates your society. But it also emancipates your women. Not just because they work in healthcare, but for example, let's take the example of childcare. We have a very big and well built out childcare system in Belgium. And it has made our women much more emancipated than the women in countries around them that maybe have more legal rights. But in Belgium, you can exit a violent relationship much more easily because you're more economically independent, because the childcare system is there for everybody. And you see that right now, where the childcare system and the whole healthcare system in Belgium as well is under attack. And I mean, we built a lot of cathedrals during the Middle Ages, but I think this is the biggest cathedral that we built in the 20th century. These social rights, these self-determination rights, and it's being demolished right now, even with us. You see that it's the healthcare workers that are suffering and that are exiting the system. You see that the access for women and for their loved ones is getting lesser, so that they have to take more unpaid labor and can enter the work and labor force harder, so it impacts them on every level. And I want to stress, I mean, okay, I am left-wing and progressive, but this is not a left-right issue. This is about, yes, social ascension for the individual, but it's also about securing the economic welfare of your states. This is an issue that should concern every party and everybody who is in politics. From the moment that you touch your healthcare system, you're touching all your citizens, and you're also touching the riches of your state.
So yeah, round of applause. So I love this metaphor of healthcare as a social elevator, and just it's fundamental to everything.
And I have to say, I'm sorry to interrupt you.
Please.
I'm very enthusiastic about this. I am a product of this. Yeah. I am a daughter of a single mother who, I'm the first one to get education in our family, but it is by being healthy in the first place that I could access this. It is the doctor and the doctors and the psychologists who talked about our situation that got us ahead. I mean, I was a very sickly child, and having this access made sure that I could ascend the system and be here today, which I still, every day I wake up and I can't believe it. And that's what the system does in Belgium when it works well.
Yeah.
It really liberates women and their communities.
And to your point, we have to protect it. You can't, Tanya, so we've heard about some of the policy mechanisms. Let's shift to investment. So only 1% of R&D funding globally goes to women's health outside of oncology. What would it take to shift that, to drive more investment in women's health?
It's a huge question, which I've been trying to find a solution for in my mind for the last until when you sent me the question. And another interesting, sad data point is that in addition to the 1% you mentioned, is that only 2% in the world of VC money goes to women and women teams, female teams, which is a really sad thing. Now I'm a lawyer like our colleague before. And I work in pharma, which is a highly regulated space. We have rules about everything and SOPs. And what I was thinking in terms of how do you drive the change? If you were all you know how we all know we have rules about things, right? We all know that red means stop, green means drive. And for some reason, I almost think that we could use these rules, like in our space, in our business, which is health, and for obvious reasons, it's a hugely regulated space. We can use rules more in terms, and what I mean by that, I'll name an example which worked well in our company for something else. There was conversation here before about equal pay, which is something that Iceland installed into law. And in my company in 2020, when I joined, we had a discrepancy in our equal pay. We did an analysis, and this was a legal thing, right? We could have been irritated with this. It's another rule, or we could have done it to check the box. We decided to embrace it. We took the equal pay, and the difference at that time was around between 5 and 6%. And we have every single year done this research, and this year it's down to 0.4. So it took us these, only 5 years to get it right. So what I'm thinking, because I was trying to think in my mind about a solution for this problem and how you can incentivize. I mean, many countries, including Iceland, have government-backed R&D funding in any different shapes in different countries. A lot of the time it's linked to R&D. So one idea would just to actually add that, and policymakers here and politicians can actually do this relatively simple. They could make rules which could change and create 2 new criteria. One would to be encourage, again, all these R&D funding that you have to submit, checklists. There are conditions, and then you get graded, right? And then you get a yes or no. You could add in 2 tests. One would be to have female leadership as one test, and the other one would be to go into these let's call it underdeveloped areas, which I think, if you think of it, I sometimes wonder whether the world has forgotten that women are, after all, 50% of the population. So this is a huge unmet need. I think a lot of money can be made into going into these areas. And biotech and pharma in itself, there is always a huge investment. It's long-term investment. So that's kind of what I was thinking in terms of trying to find a solution.
Yeah, wonderful. So using regulatory sort of rules and processes to your advantage, and I think you touched on 2 things. So one, to direct funding, but then also to focus on leadership, which is very much related to what I want to come to you, Ayesha. So leadership shapes everything. And very often, we don't take it into account when designing health systems, when thinking about health innovation. So what happens when we have more women in leadership positions?
Thanks, Elise, and thanks for having us here. I think we need to understand that health challenges are not just scientific and biomedical, they're also social. And technical expertise alone will not really allow us to design expert solutions, comprehensive solutions, and that's why transformative leadership matters. Who leads and how they lead matters. And we also need to take a step back to really understand that leadership is often way more nuanced than we imagine it to be. And for that, you have to allow me to take you to a very short 1-minute trip to India, to the north part of India. This is a state called Punjab. And this is a state which has been ranked very poorly on sex ratio, very poorly on infant mortality. In fact, it used to be called as the masculine state of India that would never focus on women's health. However, thanks to the ongoing effort of women leaders, and one of them being Pavneet Bharti, who's a doctor by profession, she established the first ever human milk bank in the state of Punjab through public-private partnership. And this is a comprehensive lactation management center. Now, with the center, the breastfeeding rates have increased up to 65% in the last 3 years, and they're all aspiring that with this, over the next few years, it will result in about 33% reduction in infant mortality. And Bhavneet really aspires and Bhavneet is really aspiring that she can take her state to become one of the top 10 states in India in terms of lower infant mortality, and of course also prioritizing on women's health. In fact, last month she was telling me that her institution has also received the accreditation for becoming the friendly institution for breastfeeding. And she has also received the charge from the Government of India Ministry of Health to set up more such human milk banks across the country through a hub and spoke model. So I think this is what exactly leadership is all about. However, this intentional leadership does require time and investment. And I think we should understand that there are 3 big takeaways from this leadership story for us. One, she has been using her individual leadership to drive institutional change, to drive health sector change in terms of reduction in infant mortality and focusing on women's health. Second, she has been able to use her own lived experiences in designing this human milk bank. And these lived experiences of women really allow us to build smarter and inclusive solutions. And third, most importantly, she was supported by this huge community of women leaders locally as well as globally. So I think that's why we invest in women leadership. And the last thing that I'll say is that evidence over the last few years is telling us 2 big things. One, that leadership really allows women to go from the survival mode to the thriving mode in these complex political systems. And second, that leadership in health is really being reimagined and redefined. In fact, when I was doing my PhD in health research, leadership was all about just authority. But today, leadership in health is about practicing authority embedded in a purpose to drive generational health impact. And that's why we invest in women's leadership in health. Thank you.
It's a beautiful story about the potential of women's leadership, and I think something that you touched on is also that when women lead, we also identify the problems that matter, right? So it's not just about great solutions; it's about like what we really care about.
Exactly.
We have just a couple of minutes left, so in this...
Add on that for a quick second?
Please.
I mean, I think it's really important, and I think it exemplifies the kinds of people that we need in all levels of leadership, and especially in elected office. I'll speak for the States, but I think it's around the world. You know, when you limit access to healthcare, when you limit access especially to reproductive healthcare, women's healthcare, I mean, that's how you march towards authoritarianism, right? When you control people and how they have bodily autonomy, what they have access to. And so the kinds of people that you're putting in these positions is critical. And for New York, we didn't have reproductive healthcare protections until 2019. And that's kind of shocking for a lot of people because if you think about New York being this progressive state, and yet we didn't have really many reproductive protections until 2019 when we passed the Reproductive Health Act. And so having more women in office and having more women who are bringing their lived experience is actually going to shape the narrative and make the change that we want to see that other folks, and for us, other states, but really other countries can follow too.
I hear some applause. Okay, so very, very, very quickly, I want to end on action. This forum is all about action, driving action. So in 30 seconds, what's the single greatest leverage point for making change?
The combination of 1, your infrastructure, and 2, your numbers. Your infrastructure is your structures, your power of law, your rules and regulations, your international treaties. Guard them with your life, because those are your safeguards against authoritarianism and any kind of dictatorship. The second one is your numbers. 1 woman can be ignored, but 50 million women are awfully hard to ignore. So build a movement. Take your healthcare workers, your parents, your communities, and tell them to ask for the same thing. And then governments really do give in, and they really do invest.
Okay, so infrastructure numbers, quickly.
So, since I'm talking about the money, so I think it's and regulations. So I think it's how can you first create the policies and the laws, which are then implemented by the regulators, because we're talking about money into healthcare space. And don't forget that it's only in the 80s that clinical trials included women, which started first, and then it was legalized, put into law later on. So that would be my call of action, would be to the countries that have R&D tax breaks or whatever it is, like Iceland, Malta, and other things, would actually also focus on these very huge, big business opportunity. I would like to translate that word from the problem to a business opportunity out there. Novelty.
All right, Ayesha?
I would like to invite all of us to really become an intentional leader. I think we need to reimagine, redefine what does leadership mean to each one of us in our context. What does it feel like, look like? And it does not always have to mean linear progression at work. It can also sometimes be just creating harmony between yourself, your work, your community, your family. And for people, if you're interested in the eastern part of philosophy, I do want to take a moment in mentioning that the term leadership in Hindi means netitva. And it is derived from the root word called ni, which means to guide. So we have to guide ourselves, we have to also guide other people, and therefore become intentional leaders. Thank you.
Michelle?
I would say elect more women and elect more diverse women, both in age and background, because, and I'll close with this, when you elect more black women, you talk about doula care and access to doulas, which is critically important. When you elect younger women, you talk about fertility and how you can protect that. When you elect more women generally, you can actually protect access to the things that we need in all kinds of communities. So elect more women.
Elect more women. All right, so we have to leave it there. Thank you all for a wonderful conversation.
Thank you.
Thank you.